Good evening, everyone. The purpose of this meeting is to conduct the business of the Gettysburg Area School District. Public comment is welcome and issues will be referred to the appropriate board, committee, or administrator. Comments will be summarized in the official board minutes, which will be available by contacting the business office. If we could take a moment and silence any electronic devices, that would be appreciated. Ms. Collins, Mike, Carrie, and Tim have been excused for this evening. Everyone else is accounted for. Please stand for the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We're going to jump right in this evening to our citizens' participation, but before I get started, and for people who come to the meetings, I sound like a broken record. I'm going to ask again this evening that, as divided as we are, it's disappointing to see it as a community, but we can control one thing, and it's my responsibility to control the board meeting. So I'm going to ask everybody to be civil. There's no need for standing ovations. Everybody has an opinion that wants to speak before the board and should be recognized in a peaceful, civil manner. We've been great so far. When you look around at the other districts, I'm pretty proud that we can come in here and have disagreements and work through them without tracking each other down in a parking lot or having an issue in here. So I'm asking you again for that favor. We have 13 speakers tonight. I'm going to add an additional minute. We're going to go 4 minutes for 30 minutes so we can get into the board business. A lot of the speaking is repetitiveness, but I understand I want to give everybody an opportunity for their voice to be heard. So we're trying to limit, and by the way, we are consistent with other districts, so I'm not making this rule from nowhere. So with that, I'll turn it over to Mr. Al, and when you get to 4 minutes, we'll give you a notification. If you're close, I'm not going to stop you from talking. Just be considerate that other people want to get up and give their opinion also. Thank you.
4 minutes?
Yeah, thereabouts. I'm not...
Good evening, everyone, and thanks for coming. As our president said, we have 13 that have asked to address the board. If you would come up to the microphone and speak clearly, we appreciate that. I apologize in advance if I mispronounce anybody's name. And then again, we will give you a 1 minute warning when we're at 3 minutes if it happens to go a little bit longer than that. All right, thank you. So our first speaker is...
Yeah, the only thing I would say is if you're comfortable, if you could remove your mask. If you're not going to remove it, you're going to have to really talk loud. From where we're sitting, the mask makes it difficult for me even to hear my colleagues, let alone people at the podium. Thank you.
One of my friends from AYSO Soccer, Jarrett Don Moyer.
Was willing to mask children in order to keep them in the schools. This year is no different. Nothing has changed. The data is still clear that masking will help prevent the spread of COVID. The mandate is in effect because we need it for the safety of all children so that they can continue in-person learning and receive a free, public, and safe education. We do not get to choose which laws or mandates that we follow. This is a state-run institution, and the state has mandated everyone needs to wear a mask in the school and must have medical documentation in order to receive exempt status. For those that argue this is a power play by our state government, we are not the only state that has started the school year with districts having the option of masks, but now have switched to a mandate issued by the state. For example, the Republican governor of Maryland, Larry Hogan, started the school year allowing Maryland districts the option of masking their children. As of last week, that is no longer in effect. The Board of Education in Maryland mandated all people in K-12 schools must wear a mask. It is not about politics. It is not about a power play. It is not about constitutional rights. It is about the safety and well-being of the children in the school districts. As a last point, there will be consequences for districts that are not following the guidance. There is a preschool in this county that is closed due to cases without a reopening date because the Department of Health became aware of that they were not enforcing the masking mandate. Per administration, the Gettysburg Area School District is not currently requiring documentation to justify a masking exemption. It is not requiring proof of vaccination in response to students declining to quarantine due to vaccination status. Both these actions are in direct defiance of the mandate. Please don't let our schools be shut down by the Department of Health for not following the mandate as written. Thank you for your time.
Thank you, Jared. Next, we have Lynn Aron.
I practiced for 2 minutes, so I'm hoping I can stay under that.
We're not going to cut your mic off.
Dear school board members and administrators, thank you for the important work that you do to make Gettysburg Area School District a great place to learn. As a concerned community member, I have a few requests as you discuss the state's mask mandate. I'm concerned for the health of all Gettysburg Area School District students, their families, my granddaughter, and the staff. I want you to protect them. As a retired educator of Gettysburg, I can only begin to imagine how much teachers want to get back to working with students in person. Students want to be learning in person with teachers and classmates, and parents want their children in school. But I am worried about the safety of all of them. As you move forward, please consider how much taxpayer money you need to protect and teach our children, not how much you need to sue the state. Please inform us of the cost already spent on this possible lawsuit. Then consider, could you have spent this lawsuit money to update the Gettysburg Area School District's 23-year-old social studies resources? The requests are, please require all students, faculty, and staff to wear appropriate health masks and face shields that properly cover the mouth and the nose in classrooms, large instructional group rooms, hallways, and school buses. Please have them practice social distancing in classrooms. Please have the administrators be responsible for enforcing students to wear masks. Do not burden our teachers with enforcement. Allow your teachers to spend their time teaching our children. Precious learning time has already been lost during this pandemic. I understand these minimal requests will be challenging to enforce. However, as board members and administrators, you are tasked with the tremendous responsibility of educating our students and keeping them safe and healthy in the midst of a global pandemic. Please follow the state mask mandate and keep our students in school while prioritizing the health and the safety of every student, parent, teacher, administrator, and staff member who walks into our school building. The evidence and the science are very clear about the benefits of face coverings to stop the spread of COVID-19. If you and we can save the life of just one student or staff member by following the state mask mandate, wouldn't it be worth it? Thank you.
Thank you, Lynn. Next, we have Susan Sibel Willard.
Good evening. I know you guys are tired of hearing from me. However, I stand here with a little bit of a different approach. I left the last meeting feeling speechless. I was speechless about the way people talked to you guys and the way they treated you. I'm an administrator on a much smaller scale. And if people had talked to me that way, I probably wouldn't be in my current position any longer. I appreciate everything that you're doing and trying to do, and I want you to hear those words from me. However, I want to go over a couple statistics. Well, no, wait a minute. First, I wanted to personally thank Sylvan. His comments at the end of the last meeting regarding the safety of his grandchildren and worrying about other people's children personalized that for me. You're personally invested in the children in our community. I appreciate you. Kenny, the way you ran that last meeting, kudos.
Thank you.
You did more than I ever could have done. I appreciate you. Al, thank you. You're supporting an initiative that's close to my heart, and now you're sitting here and taking a lot of flack from a lot of people you don't even know. Thank you. I wanted to share an email that I received on Friday from a parent who was keeping her child home. And she said that she would let me know whether the child had COVID. So my response to her was, Has your child been informed that they were a close contact? This is the parent's reply to me. We've not been informed of any close contacts. To be honest, I don't have trust in the school's level of contact tracing or how seriously they're taking this. The nurse called me yesterday saying that my child had a sore throat but no other symptoms, so she sent her back to class. I work in a school district where if this had happened, I would have had to pick my child up immediately. Parents aren't trusting our schools. That's heartbreaking. I'd like to make a simple suggestion. The dashboard is really confusing. It's giving us a 2-week window. Could we just have 1 week's total and then a cumulative? If you want a really good example of what a dashboard should look like, that's easy for the general population to read. Waynesboro Area School District has a very good one, where they put current student cases, current adult cases, and then total since the start of the school year. Another statistic, a man stood up here 2 weeks ago and said that the mortality rate in children was really low. However, children are still dying from this, and I beg any one of you to ask a parent who lost a child to COVID if that mortality rate mattered to them. Currently, we've had 483 cases of COVID in children aged 0 to 9 since the pandemic began. That's an average of 52 children in Adams County a week. Currently, there's been 8,824 cases of children aged 10 to 19. That's an average of 114 children a week. Adams County has a statistic that I don't think we should be proud of. 65 children in Adams County have been
1 minute,
hospitalized because
Suzanne.
of COVID. That's the 3rd highest in the state of Pennsylvania. That's pretty sad. So, I also wanted to reflect on our mission and our vision, and then I'll be done. In the mission of the Gettysburg Area School District, the one sentence claims, our purpose is to provide a safe and healthy environment in which all students can learn. In our vision, it states, the district will provide a safe and caring learning environment where students can learn. Under these current conditions, I don't know how that's going to happen or continue to happen. All we have to do is take some simple steps. I now look at this, and I'm sure we've all seen it. From the CDC, it says, wash your hands, cover your mouth, and take care of your diabetic child.
Very rude
Wear a
and
mask.
inappropriate.
Get a vaccine, and stand 6 feet away.
Thank you.
It's not rocket science. It's easy for all of us to do when we come together. Thank you.
Thank you, Suzanne. Next, we have Dawson Smith.
I'm not a public speaker, so I don't know how well this is going to go. But yeah, I'm Dawson, and I do support the guidance of the Pennsylvania Department of Health towards masking. I know that was kind of a last week thing. I was here last week, and I wanted to say something, but I chose not to. But I figured I'd come here this week to share it. So 18 years ago, when I was just 2 years old, I was diagnosed with leukemia. For the next 2.5 years, I received a daily regimen of chemotherapy and a slurry of other drugs that I don't even know the names of. This compromised my immune system for those 2.5 years. And many people may not be aware of the precautions that people, specifically my parents, had to take to keep me safe. For example, when driving, we could not have the vents open in the car because there was a risk that an airborne particle could enter through the car system, so we had to recirculate the air inside. When I got home from the hospital, my dad and my grandfather had to sanitize our house, clean the carpets, clean all the appliances to make sure that there was no risk of infection. And even up until kindergarten, my mom would come in and sanitize toys to make sure that there was no risk of infection. Let me see where I'm at now. In addition to this, one of the largest preventative actions that was taken was making sure that I wore a mask and making sure that those around me wore masks. They wore masks not because of a mandate, not because, and I do hate this term of, sheep or any other sort of term towards people who wear masks, but because something as simple as a cough could kill me. I wear my mask for that 2-year-old. I wear my mask for all of the parents and educators who may have a child or may have a parent or may be themselves have the same situation that I was going through. Because for 2.5 years, I was that family member. This is why I support the guidance from the Department of Health. And I know that last week, I forget who it was, I believe it was a couple of you, said that this is a lose-lose situation or that you can't please everyone. I totally agree that this is a tough decision. And going forward and enforcement and everything like that, it's tricky. And I respect the entire board, no matter who you are, for having the endurance to take on this, listen to the public, take criticism, and just anything else. So I totally respect that, and I hope that more productive discussion can continue, and regardless of the form. Thank you.
Dawson, thank you. Next, Jenna Aron.
Good evening, board. Thank you very much for the opportunity to speak. I truly feel like I have nothing to say after Dawson spoke of his experiences. I have been here talking about other issues, but this evening I would like to talk about COVID. And I'd like to talk about it from the perspective of thinking about others and thinking about the collective good for our community. I'm really concerned about what this means for our most vulnerable students. We know that all students learn best when they're in person and when they're with their teachers and their peers. So I think doing anything we can to keep our students in school with their peers and with their teachers are essential. And it's clear, whether we like it or not, that masks are one of those factors that are helpful. I don't like wearing a mask, but I do it because it's helpful for others, it's helpful for myself, and it keeps our community safe. When I think about the number of vulnerable students and underserved students that we have in this district, I recognize the important significance, truly, of following everything we can do to keep our students safe, meaning wearing masks, spacing students, and air ventilation, all 3 important factors. When I think of the number of EL students we have in this district, EL students really need to be in person. That's one of the best ways to raise outcomes for our EL students. This is also true for our students with special needs. I really think we need to think about what is the collective good for our district, what is the collective good for our community. And then I also think about our healthcare systems and the taxing experiences that our physicians are facing right now in the emergency rooms in Gettysburg and throughout our county. I have turned down multiple requests to travel for work because I'm afraid to go to communities where I know that the emergency rooms are overtaxed. If anybody is in a car accident, if anybody has a heart attack, if anybody needs to get to an emergency room and our physicians are essentially bombarded with people as a result of COVID, and we as a school district can help prevent some of this taxing, I mean, it's exhausting for our physicians. I have a friend who is an ER physician in a pediatric unit. The number of kids on ventilators right now in his ER is astounding. And he sends his kindergartner to school every day saying, please, honey, do not take your mask off, wanting to show her the pictures of the kids he sees on ventilators. The Delta variant is different. Last year, we were not faced with it. I think we need to really come together as a community and understand that this is a choice that's challenging, it's not fun, but we need to get through this together. Thank you.
Thank you, Jenna. Next, we have Derek Scott.
All right. Thank you, board members, for listening to everybody speak today. I know it's been a lot of repetitive stuff. But I guess I just want to start out by talking a little bit. I mean, first I'd like to say I would much rather be talking about stuff that's actually going to improve the education of the students in the district and not have to really harp on COVID. Hopefully it doesn't last that much longer and we can all get past it. I know nobody likes to wear masks, myself included, but it does seem like the masks have proven to at least reduce the spread somewhat. And I think it's not really a super invasive thing to just wear a mask for the hours that you're in school, just to keep the spread down so that everybody can continue to send their children to school and not have to have quarantining events where the kids have to be at home, and parents who work from home, and even some parents who can't work from home. If you can't work from home, I guess you have to take off work, or if you're like myself and you can work from home, it's just a distraction to have, especially if you have small children at home. I'll just tell an anecdotal story. I have a 3.5-year-old, and we had to keep her out of daycare last week because she just had a little scratchy throat. I mean, we knew it wasn't COVID or anything like that. She didn't have any fever. She didn't have really any symptoms. She just complained about her throat being a little scratchy. So we kept her home from school, and we had to work from home around her, and it's hard to do meetings with a 3-year-old running in or trying to write something when every 5 minutes they're asking you for something. And so in order to keep like the workflow for parents going, I feel like it's important to have children wear masks in school, like I said, just to calm the spread and keep the classrooms open. It's just, and like I said, I couldn't even imagine if I was a person that had to actually take off work to, and some people don't even have vacation time. You have to take off work and then you're not getting a check because your child has to stay home from school. It's just really difficult for parents, and I think that it's important that we keep the schools open, we keep the spread down. I mean, with my daughter, like I said, we knew she didn't have COVID, but we had to bring her to get a test. And it wasn't the invasive, it wasn't the one where they scrape your brain. It was just a nostril, a little nostril swipe. She was all nervous about it, but after they did it, she had, she was actually relieved. I think for some reason she thought it was gonna be way worse than it was. And obviously she was negative, so we were able to send her back to school this week. But I mean, if everybody would just take the time to wear masks, and hopefully that more people won't have to go through that type of stuff. And like I said, hopefully that we can get past all this and get back to trying to do more substantive things that will actually improve the outcomes for children and the educational process and the educational experiences of children. But for right now, I guess we got to focus on safety issues. And so I think the easiest, or least invasive version of this is sending kids to school with masks on, because there's a lot of evidence that shows that kids learn much better in a classroom. I think most people can agree, I don't want to speak for everyone, so I say most people can agree that last year when children were learning, or 2 years ago and last year, I guess in some instances, when children were learning from home, it was just, there wasn't really a lot of education going on. It was just half days of them staring at a computer screen and not really doing anything. I guess I'm just speaking from my own children's perspective. But I guess in closing, I just want to say that it's important to keep the children in school because they learn better that way. It's also important for the economy, to keep the economy moving, because parents don't have to take off time from work to stay at home with their kids. And I think it's just in the common interest of everyone to wear masks so that, God forbid it doesn't get worse, and then there's more invasive mandates that I don't think any of us want to see. So, if we got to put up with a little bit of stuff we don't want to deal with in order to avoid putting up with worse stuff that we have to deal with, I think, it's a little bit of a give and take when you're dealing with big institutions that, I think we all know like to impose things on people. We don't want to give them more reason to impose things on people. So I think if we can all just come to a common agreement that we need to just, wear the mask for the time being until this blows over, and then we can get back to normal life, I think we can then move forward from there. And that's all I'm going to say. Thank you.
Thank you, Derek. Next, we have Aaron Weichert.
Hi, my name is actually Erin Nykirk, so thank you. I want to thank the school board and administrators for everything that you do, and all the teachers, just to give them credit for what they've had to endure. I hope that you will refuse the unwarranted mask mandate and allow the children to learn and thrive in an unrestricted manner with confidence that they and our community are healthy and well. Knowledge is power, and an ancient sage has once said, "You shall know the truth, and the truth shall make you free." People aged 0 to 25 have a 99% recovery rate from COVID-19. There is no need for a vaccine among this age demographic. Their own immune system has taken care of them and will continue today. Today, September 20th, 2021, as of 12 p.m., from the health.pa.gov website, they are reporting a 91% recovery rate for COVID-19 in the state of Pennsylvania. A 91% recovery rate. That is good news. That is tremendous news. That is an epidemic of recovery in our state against COVID-19. I wish that were the front page news. The district has the right to refuse this unwarranted mask mandate, as does each family in the state of Pennsylvania. A simple declaration of refusing to comply with the mandate is sufficient. No legal action is needed because the state and the governor know that this massive overreach of power against our individual rights will cause discrimination lawsuits. Children have a right to be educated mask-free and not be discriminated against. The mandate states that, page 5, section 5. Parents, I want to encourage you to know your rights, to go to libertyfirstsociety.com and watch the non-compliant movie. Constitutional lawyer Chris Ann Hall will give you quite an education. For those that may be afraid of you or your loved ones contracting COVID, early treatment and medication are available. I can share 2 websites with you, flccalliance.com and the website frontlinemds.com. Both of these websites provide prevention protocols with supplements. They have early treatment, medications and recommendations available, and doctors available for telehealth communication. They also have hospitalization protocols available on their website. I urge the school board to represent the people of this county and refuse the mask mandate and return to mask-free education for all students. I didn't know I would be limited. I would have more than 2 minutes, so I would like to add a few more comments. I know that the school system has updated their ventilation system. So we've already taken measures to improve the environment that the students are in. So thank you for that. Just also wanted to demonstrate something that I think we've all been taught. Achoo. Germs go in the elbow goes down away from the face, not held in a warm, wet environment to foster continued sickness. We can also take a step back and maybe look at other countries that have done different things. The country of Sweden has nearly 2 million students in their education system. They did not mask and they did not have vaccines available. And in the entire 2 million students, 15 students got sick. So I do also have an email filled with evidence about the lack of efficacy for the masks really providing a lack of spread. If people would like, I can forward that email to the school board and the administrators, or if anyone would like to have that information forwarded
to you from me. My email is eneikirk@gmail.com, and I would be happy to share that information with you. Again, I urge the school board not to continue with the mask mandate. Thank you.
Thank you, Aaron. And we do have your email on the slip that you provided for us. Thank you. Next, we have Michelle Smyers.
Good evening. I'm not going to talk about COVID. I'm not going to talk about masks. I'm going to switch it up for you. And I am going to talk about 10th grade accelerated English. My son is a student in the class. About 10 days ago, his teacher sent me a syllabus for the class. The syllabus was missing the book list, and by definition, a syllabus should also contain the list of books that they are planning on using. With the exception of the year of 2011, I have had kids in this district since 1994. I have received a whole lot of communication from a whole lot of teachers. And every time I received a syllabus, it's had a book list on it. So I sent the teacher an email and said, hey, could you just please send me the book list? Her response was the following. My instructional choices are fluid in response to students' needs as they return from virtual learning. Since I am a first-year teacher, I'm in collaboration with my department to determine which text will be taught. That being said, every 10th grade English teacher does teach Greek mythology and Oedipus. As mentioned in my syllabus, this course involves the study of world literature. I will be reading a variety of literary genres such as novels, short stories, poetry, drama, and a variety of nonfiction. Each text will be taught to the PA standards, which will prepare students for the Keystone exam at the end of the course. I hope this helps. Still didn't get an answer on books. So I sent another email and said, could you give me a list of books you're planning on reading? If you have a list of genres, I would think there's probably a list. After 3 days, I didn't hear from her. I emailed her again. I know you're busy. I'm busy too. Could you please send me the list of books? Didn't hear from her. Instead, I called Mr. Lusk. Mr. Lusk has informed me that yes, there is a list. She doesn't know what book she's going to use yet, but if I want that list of books, I need to follow Right to Know. I think it's a little crazy that I have to follow Right to Know to find out what books you're going to be using to educate my child. And I'm pretty sure Mrs. Wallen has other things to do than answer my Right to Know. The last thing I want to bring to your attention is that I happen to know for a fact that as of 7 a.m. this morning, there were no less than 50 substitute positions available at Gettysburg School District. I also know for a fact that there are substitutes that are willing to come and work at your school. However, some of the subs would like to wear a face shield instead of a mask. And according to the mandate, of which I have a copy right here, it clearly states that face masks are acceptable. I would like to ask this district to please consider allowing your substitutes to wear a face shield in place of a face mask so that you can get those 50 substitute positions filled. Thank you.
Thank you, Michelle. And just a quick remark regarding the book list issue. I do appreciate you starting with the teacher and then going to the principal and following the chain of command. When we have specific questions like that come to the board, we will turn those over to Dr. Perrin or Dr. Lay and have them follow up with you, but I appreciate you following the chain of command. Thank you. Next, we have Sharon Birch.
Sorry for the long walk. I was trying to promote not sitting on top of a bunch of people. My name is Sharon. I have a child in the high school where, as of Friday's dashboard, 17 reported positive cases. I just wanted to say that I'm in full support of masking. I appreciate the effort that the district administrators, staff, and especially teachers are making to enforce the mandate, regardless of whatever level of support they may or may not be getting from the school board. Thank you.
Thank you, Sharon. Next, we have Zach Davis.
Good evening, school board and community members. My name is Zach Davis. I'm the father of 2 young children who are 5 and 6 years old, attending Franklin Elementary. Tonight, I'd like to give you my take on CRT, or critical race theory, and why it should stay out of our schools. We live in a great country, and it's an amazing place with amazing opportunities and an incredible history. Critical race theory does not focus on these things. Instead, it emphasizes the negatives. Can you imagine what it's like for our children growing up in today's society? Due to the mask mandate, our kids don't get to see other people's expressions, which is an important part of socialization. And then you're told you may be spreading deadly diseases and killing people. If you're white, you're told that your ancestors are responsible for all the evils of the world. If you're black, you're now all of a sudden a victim and told you can't make it in society. Then on top of all that, forget about biology, forget about science. You may not be a boy or a girl anymore. And we're expecting our kids to grow up and be normal. Are you kidding me? As our children are trying to develop their own self-concept, this crap gets thrown into the mix. What effect is that going to have on them long term? This isn't even about politics anymore. This is about people who appreciate America for the ideal of liberty, freedom, and justice, versus people who want something completely different, a utopian society where the government takes care of you from cradle to grave, where you give them all the power. That doesn't work. Our nation will not survive a generation of leadership even more poorly educated than what we have right now. And we won't survive a generation of students taught to hate its own country and despise its history. We should be looking at ways to create unity and common ground instead of institutionalizing our differences and fighting with each other. That's all I really have to say for tonight. Thank you.
Thank you, Zach. Next, we have Frederica Meitzen. And Frederica, please correct me if I mispronounced your name.
Thank you. And you have to have German in your blood. You got it right. Both names. Thank you.
Sometimes I'd rather be lucky than good.
That was brilliant. Thank you for this opportunity to speak to the board. I come not as a parent, but as a pastor that goes to different churches, working with churches that have, in my denomination, that have conflict. And so I know conflict when I see it. It's important that we figure out how we're going to deal with conflict. And beginning this meeting today was brilliant. Thank you for your words. The last meeting that I attended 2 weeks ago was rocky. I think we can all agree it was rocky. And I don't think any of us were too happy for that. So I appreciate your stipulations early on and offering us how we do this. How we learn to disagree in a healthy way is what I would like us to be attentive to. This is a controversial issue, obviously, the whole idea of masking. How we are going to talk about that is important, I think. I wanted to say, as a pastor, I deal with senior citizens and families with young kids, and they come together. And so we're not just talking about the kids in school and then coming home. They do come home to their grandparents or aunts and uncles or neighbors, and so how are we going to deal with this? Our science says masking is the thing. I think we're all eager to move beyond that, but until we do that, perhaps we need to follow science here. I met with a young mother who was very concerned with how to deal with her kindergartner and second grader, how to mask, because they were masking in their school. So she sat her children down, kindergarten, second grade. Many of you know that. And she said, I talked with them and explained to them that the masks kept them safe, but also kept their grandparents safe and other people. So she explained to them what the issue was and said, you can help us. If we all do this together, we'll get ahead faster and get out of this time. And she showed them how to wear masks, etc. This is a kindergartner and second grader, so I was rather impressed myself with how she did that. And the little kindergartner came home that after the first day of school. I just have to share this with you because it's beautiful. Put me into tears, and she said, Mommy, I wore my mask all day. Yes, it was hard, but I'm keeping Grandma safe. I just thought that was beautiful. A little kindergartner who had figured this out. So thank you for being here together and for talking in a pleasant way. We will figure this out, but if we are going to survive as a country, we need to do it together. Thank you very much.
Thank you, Pastor Frederica. Next we have Smitha Nair.
Good evening, everyone. I want to thank you all for this opportunity to address the board. I would like to address the growing debate around Governor Wolf's mask mandate and the Gettysburg School District Board's decision to challenge that. I am a board-certified family medicine physician who has proudly served Gettysburg and the surrounding community for over 15 years. My decision to dedicate myself to this career and sacrifice over a decade of my life to medical training was based on a passion for ensuring the health of families throughout their lives, enabling them to live their lives to the fullest in good health. Nothing more, nothing less. Since the advent of social media, misinformation about medicine and healthcare has proliferated. Universities like Google, Facebook, or WebMD have succeeded in letting people earn their medical degree in a day, while it took me nearly a decade to become a fully trained physician. While I advocate for patient empowerment and education, the science and rigor behind our practice guidelines and treatment recommendations takes years to fully appreciate. Through mandatory continuing medical education, every physician stays up to date on developments in their respective fields in an effort to provide patients with the best possible care. I am saddened and disappointed to see how the politicization of a global pandemic has deviated us from common sense policies that protect our children and our communities, and led us down a path to hundreds of thousands of preventable deaths. I'm also angry that the public that turns to us physicians in the deepest moments of vulnerability and need turns around to mistrust and blatantly disrespect. The bond of the patient-doctor relationship has been violated. I am also angry that my physician colleagues and other hospital employees have to work in these conditions, tired beyond words, dealing with preventable deaths on a daily basis. We physicians are trained to preserve life. As students, we looked up to our principals and teachers to set an example for us to follow. And by doing so, it taught us to be disciplined, follow the laws, and respect authority. In other words, be good citizens. What I see today baffles me. How can our school administrators and board members who are our children's role models defy these principles? What example are we setting for our children? What future are we creating by doing this? And what about the warrior pride? GAM's warrior pride includes teaching lessons on the importance of having a positive attitude, being respectful, demonstrating integrity, good decision-making, and showing empathy. By voting at the last board meeting to challenge the Governor Wolf's mask mandate, many members of the board have shown lack of concern for their fellow community members and the warrior pride statement. As a physician and speaking on behalf of my colleagues, including nurses, physician assistants, medical assistants, technicians, and many more who dedicate their lives to saving yours, I kindly request that you consider the safety of our children and community and not challenge this mandate. It is not a battle to be fought, a show of bravado, but a common sense decision to be made for the health and safety of our children. As a physician, I have taken the Hippocratic oath to do no harm, to serve my patients, and treat them to the best of my ability. I know if cases rise and we face another outbreak, I would step up to treat the sick in a heartbeat. Having said that, would you consider this? What if all the healthcare professionals decided it was their freedom of choice to treat only those who complied with the rules and turn away those who didn't? How unfair and cruel would that be? That is exactly what is happening if we choose to ignore the very guidelines designed to protect us.
30 seconds, please.
Thank you for the time, for listening to me, but I kindly request all of you to come together as a community and work together on this, just for all our sake, for the kids' sake. If I had to meet with each and every one of you to make this humble request, I would. But I'm doing it right here. Hopefully, everyone is listening. So, thank you.
Thank you. Next, we have Carol Rebert.
Go a little slow, I apologize. Good evening. First, I would like to express my appreciation for your continued commitment to parental choice when it comes to the decision to mask our students. I realize this, quote, mandate is putting the board in a difficult position. I hope that this will be resolved in time. I also appreciate that you're giving us a voice and willingness to have a conversation. I also wanted to update you on the Moms for Liberty movement. Since January, our chapters have grown to 120 chapters in 29 states, with many more chapters waiting in the pipeline to be approved. Pennsylvania alone has 14 chapters. Our local group has close to 300 members and is growing daily. Nationwide, there are over 45,000 members. The last thing I want to focus on is the importance of parental and community involvement in the education of our children. I've been criticized because I no longer have a child in the district. However, I do have relatives and children of friends in this district. I am also a taxpayer in the district. When my son was in school, I took advantage of many opportunities to stay involved. I helped in the classroom.
I was very involved in the PTO. I went in field trips and I marched in Halloween parades. I had conversations with my son's teachers routinely. One of the most memorable was my involvement in the steering committee for the 4-5 school plan in Gettysburg School District. I was asked by Ed Ruggles to participate as a parent in the district. I was kind of surprised as I was very outspoken against the project, but I agreed. Not saying that none of my concerns were realized, but overall I thought it was a great experience for my son, and I was sorry when the district stopped it. In closing, I would like to encourage parents to get involved in their schools wherever they can. Every elementary school has a PTO. Get to know your child's teachers and don't be afraid to ask questions. Ask about volunteering in the classroom. Volunteer to help chaperone field trips. Gettysburg School District also has advisory boards for Title I in each elementary building. There are parent advisors on each of those boards. Ask to be put on these advisory boards. If you can afford the time commitment, consider running for school board. Be committed to help give your child the best chance to be successful at life. Thank you for letting me speak.
Thank you, Carol. And our last speaker this evening, Karen Martin.
Good evening, board. Thank you for taking the time to listen to all of us this evening. I wasn't planning on speaking until I witnessed grown adults standing here begging you to mask children. I have a huge problem with that. I'm strictly against the mandate. You know the statistics. You've heard it all. I'm not going to stand here and repeat it. I'm simply going to ask, why is no one speaking of the psychological damage to children? Does anyone care? Or is it just about you feeling good about yourself and your safety as an adult? Are we really thinking about the children? So I'm going to yield the rest of my time to a 2-year-old named Mason. You know they mask 2 and 3 and 4-year-olds at daycare, right? It's amazing how many people don't know that. It's not just the K through 12. It's the 2 and 3-year-olds. And I know because I have 2 and 3-year-old granddaughters. So I'd like to just play something for you. You can't see it, but you'll be able to hear it. And if you have a heart, I'm sure that you'll feel it.
No, you gotta wear it on, honey. No, you gotta keep it on.
Can you guys hear it?
Put your mask on. There you go. Keep it right there. Yay, Mason! Yay! Keep it on, Mason. Look, we're gonna keep it right here. Look. Peekaboo, I see you. Keep your mask on. Put your mask back on. What are you looking at? Come, keep it on your face. You gotta keep it on your face. So we go outside. There you go. Mason. No, keep it on.
In that minute and 19-second clip, that daycare worker applied that mask over his face 9 times. 9 times he removed it. I think you all need to think about the children. Thank you for your time.
Thank you, Karen. And that wraps up public comment.
Well, before we move on, I do want, on behalf of the board, and especially for my own sake, thank everybody for being civil here this evening after watching some other meetings. I know there's some differences, and I respect the fact that you take the time and come up here and give us your opinion, your perspective on stuff. The board obviously volunteers, the administrative and the staff have their hands full, and we're trying to keep our focus, and I believe Mr. Scott said it the best, our focus back to the educational process of our kids. So thank you. Having said that, we will move on to routine approvals. For the board members that are present here this evening, I did not get any notification that anybody wanted something separated. Does that remain true? May I have a motion for 5.1 through 5.10?
So moved. Amy Beth Hodges.
Second.
Question on the floor.
Mr. President, this is Carrie.
Carrie, I apologize. I did not know that you were on here. I'll add you on to that. Go ahead, Carrie.
Yep, I've been on the whole time. I do have a question for the financial report.
Go ahead.
There, on the general fund, I'm pausing because it seems there's a little bit of a delay. There's an item, it's listed as 95% group incorporated, and the description is LE for phonics program. My question is that LE for Lincoln Elementary? And will be there additional purchases for James Geddes and Franklin Township in similar amounts?
Belinda, are you equipped for that? Carrie, speaking with Belinda, she would like to have an opportunity to look into that and get back to you.
Okay, thank you.
Are there any additional questions?
That's my last question.
Hearing none, roll call. Amy Beth?
Yes.
Timon?
Yes.
Sylvan?
Yes.
Al?
Yes.
Kathleen?
Yes.
Carrie?
Yes.
And I vote yes. One second. We're going to pause real quickly here. I'm going to allow, seeing there's no items for board action, under the information items, I'm going to turn this over to Jason for a minute.
Okay, just back to the Human Resources report. Just wanted to introduce Rebecca Leathery. Is she still here in the back?
Waving her arm way in the back.
All right, so after a long, exhaustive search, Rebecca will be joining the district as the new communications coordinator. She'll be starting in a couple of weeks. We're very, very glad to have Rebecca joining our team, and hope that she gets around to meet everybody soon. We're very fortunate, and Rebecca joins us from industry. So welcome, Rebecca.
Okay, under informational items, the curriculum cycle, I believe, Dr. Lay, were you going to address that? Thank you.
Christine Lay, Assistant Superintendent. My purpose tonight is to share the Gettysburg Area School District curriculum cycle in an attempt to explain the timely process of curricular revisions. The 5-phase process includes study and research, gap analysis, curriculum alignment, curriculum writing, pilot and implementation, evaluation, and revise. In the 2019-2020 school year, we adopted the Understanding by Design UBD curriculum writing model and began implementing this with our math, science, and English departments. Our work was abruptly interrupted in 2020 due to the impact of the pandemic. Our efforts were redirected toward designing a hybrid and blended learning environment while managing temporary school closures. Work typically conducted by teachers in the summer was delayed, and our inability to secure substitutes prohibited us from continuing our efforts during the 2020-21 school year. Some work continued during the summer of 2021, and we look forward to gaining momentum during the planned professional development days this school year. Completed UBD curriculum maps will be presented to the Board of School Directors for approval. Learning maps, curricular resources, national and state standard aligned documents guide the teacher's lesson plans and instruction. These documents retained in digital files by the department and grade level. These files were not posted on the district website in our attempt to be more homogeneous in our process using the UBD model, but this information will be shared by the end of September 2021. This decision lies with me after numerous requests for transparency of the district curriculum. If questions arise, I encourage parents and community members to direct them to my attention at clay@gasd-pa.org. Currently, teachers are bombarded with the demands of instructing their students while ensuring absent students are receiving instruction and assignments for prolonged periods of time. They remain cognizant of their students' mental health needs while ensuring students practice health and safety measures to mitigate the spread of the COVID variants. I urge you to have grace with them when you have questions or concerns regarding their instruction or material selections. The teachers are doing the best they can to keep their focus on teaching and learning while navigating the matters named above. Now more than ever, teachers need to feel supported by our parents and community, so please be patient and kind when interacting with them and their building administrators. Thank you, and do you have any questions?
Dr. Lay, before you sit down, thanks for providing this and for the 5 steps in our curriculum review process. There's been some questions from the community recently regarding closing the achievement gap. In step number 2 of our process, am I assuming that that's what we're talking about there? And in your feeling, do we have some data to support that are we making some progress in that area with our historically low achieving students, the subgroups that historically are in deficits and so on?
Well, phase 2 really would be a gap analysis of the current curriculum in alignment with newer standards and resources, but certainly throughout the process, adjustments are made based on local and state benchmarks that we're conducting. So it is an ongoing process, and we have a lot of data that we are collecting to make our decisions when we make revisions to our curriculum and instruction in our classrooms. So yes, that data is available if that was your question.
And Dr. Lay, would it be fair, given the circumstances that we had to deal with last year and the lack of the state testing and stuff, that it's going to take us a little bit to look at this, to gather this data to make sure that we're accurate?
I mean, we have local data that we've conducted throughout, so there isn't one single data point that we use to guide our instruction, but yeah, it's ongoing. When kids come back from remote learning environments, temporary school closures, and just a typical summer gap, we start every year with new benchmarks.
I appreciate you addressing that because, as Al said, that we have seen an uptick in communication to the board reference to our curriculum and to our achievement gaps. And I appreciate your words tonight because being in this district and having 3 kids through it, I can't tell you one teacher here that wants to see a child fail or get left behind in any subject. So I appreciate it. Thank you.
Dr. Lay, may I ask a question of you?
Sure.
Have you heard of a parent needing to file a right to know in order to get a list of books for a classroom?
I'm aware of the situation that was spoken about this evening, if that's what
Do
you're
you
asking.
feel like it's isolated, or is that something that has happened in the past, just from your knowledge?
From my knowledge, it's This is the only situation that I'm aware of.
Thank you, I appreciate it.
You're welcome.
I think that Jason Perrin, superintendent, I think Ken also took kind of a broader answer to your question earlier. Not just curriculum processes kind of were interrupted by COVID 19 months ago. There are several initiatives going on in the district where doing school took absolute priority over some of the work being done. And I wouldn't say not just last year, but this year as we continue to be responsive to students being in school every day, which is certainly the model that we prefer. There are some things that we are working on that we just didn't even start, just because we want everybody's efforts to be on not just the mechanics of how we're going to do school, but then operating instructionally within those models to best meet the needs of those students, not just educationally, as Dr. Lay stated, but there's also kind of the social emotional piece. Just as we started this school year, and teachers, generally spend some time building classroom community. That's just what you do as a teacher. We gave folks the opportunity and the ability to spend some extra time on that because we had, the wide gamut of students who hadn't been to in-person school in quite a long time, and there was some anxiety in terms of coming back to that. So we want to make sure that we're being responsive to to all students. So yeah, there are a lot of processes that got interrupted 19 months ago that still remain disrupted, but the goal is always going to be instruction. So we just got to keep our eye on that ball.
Kathleen Pratt. Dr. Lay, thank you so much for helping to educate all of us up here on the district's curriculum development, management, and assessment. And I would just say to you, please continue to communicate with us and let us know how we as a board can support you and the administrators and teachers in that effort.
Thank you.
Dr. Lay, I'll just add again, I got to come back to this. This is something that, because we get a vested interest in it, that I'd like to see reoccur. And actually, I think the district's better off when we really become transparent and get the information out on our website and give the presentations here, which includes the good, the bad, the ugly, because we know that we have gaps in achievement in certain areas. So I want to tell you again, I look forward to hearing from you again as we get more detailed information. Does anybody else have any questions? Carrie.
Thank you. No, I don't.
We're good, thank you. Board committee reports. Carrie, do you have one?
Yes, I do. Thank you, Mr. President. The Finance and Facilities Committee met on September 16th. On the agenda was a discussion about future facilities improvement projects. The high school is currently in an improvement project. What was scheduled next was Lincoln. And after looking at invoices, work orders, facility department hours, man hours, they noticed that the roof units are aging more rapidly at James Geddes, and there will be a future informational item about moving the James Geddes and Administrative Campus improvement project forward ahead of Lincoln. It will eventually, after this being an informational item, become an action item because there would be a need to approve expenditures for the design of the James Geddes and Administrative Campus improvement project. The other update would be the Adams County Technical Institute. Their monthly meeting is on September 22nd at 5 p.m. And that's all I have to share, Mr. President.
Thank you, Carrie. It's my understanding there are no other board committee reports this evening. Building and program reports.
Sure, I just have a couple.
I'm sorry, Belinda.
Just wanted to follow up with Dr. Saladay's question.
Okay.
The 95% group has been ordered for each one of the buildings, and the funds that are covering that is through the ESSER 2 grant.
Carrie, did you get the answer?
I couldn't hear the question.
The question that you had asked Belinda early on, under the finance, under routine approvals, she just provided an answer. I'm not sure.
Okay.
Does she need it repeated?
Belinda, you may want to give that answer again because it was.
Dr. Saladay, just to let you know that the 95% group incorporated resources and materials have been ordered for each one of the buildings. Allocations exist for each one of the facilities, and the funds that are covering that are listed underneath our ESSER 2 grant.
I think we'll be good, and then we can follow up in an email if we need to.
Thank you.
Thanks, Carrie. Jason?
Sure. Just to follow up on several other communications, September 3rd, I sent a communication regarding information on the mandate that was received on August 31st. And then on September 8th, did a follow-up communication with a reminder and information to be sure that the exceptions allowable under Section 3 were processed. Gave a deadline of February 10th. Principals continued to work through those that they became aware of through last week. That brings us to September 20th. So there are a couple of things going on this week. That exception period has ended. So we certainly need our administrators to get back to supporting instruction, as we've wanted them to have a significant amount of those conversations because we want teachers focused on teaching and not having those conversations. So now that we're in this week, the principals will continue to work with students on compliance. And as someone stated during public comment, it's not a new process for us. We did it last year. And we're actually in a much better spot this year because we're in school every day. There's a time last year where probably we would have given almost anything to be in daily, every day, especially at the secondary level where we weren't at the time. So that certainly remains the goal. So we're in a better spot. We just need folks to continue to do the job that they did last year. And it will increase or improve our ability to stay this way, open every day in person. And then along with that, so we'll going to send a communication probably out tomorrow afternoon, tomorrow evening, just with a couple reminders. One of the other things that we're going to shift is through some feedback we've gotten with the notifications that people get with regards to close contacts and quarantine. We're going to try to simplify that paragraph that's sent to parents. So the goal would be to attach a copy of that to the communication so that folks have a heads up on what that would look like if you would continue to get those in the future as a close contact. It's basically our nurses spend all of their time from the beginning of the year till now on that process. We certainly need them to focus also on supporting the students in the educational environment with the given health needs that they would have done pre-COVID. But we still do the best job that we can given some of those other items that we assist the Department of Health with. As a reminder, we're mandated to basically report our positive cases. We assist with contact tracing as a partner of DOH. and we'll continue to do the best job that we can for that. And if we can make communications a little bit clearer for parents, then we'll always try to do that. So I'll send out something probably tomorrow afternoon, tomorrow evening, just with a couple of updates, and then we'll also attach a copy of what that communication will look like in the future, if you should get that from the nurses for close contacts and those types of things. That's kind of where we are. That's kind of where we are currently. It was, Dr. Lay talked mentioned about the work that the teachers are doing, and just by chance, I'd also kind of drafted something because I want people to understand that the teaching piece was challenging before COVID, and the teaching piece has become more challenging over the past probably 10 to 15 years. I'll always be a science teacher at heart. You can't pull that out of me. So I think about the daily work that our teachers do with students every day because it's central to our mission. We've just hit a point in the state and country, this isn't a Gettysburg thing, but we've hit a point where the profession itself has become at its most challenging level at a time where less and less people are going into the profession. So it's like a perfect storm with regards to applicants, folks that are available, and we have some really dedicated professional folks in this district, and the ability to attract and retain those folks are near and dear to my heart at a time when we might see 1 or 2 applicants for a position in 2021. Back when I started teaching, I'll say it was back before email, if that dates it for you. Back when I started teaching, you might have 300 applicants for an elementary teaching position. We're not there in 2021. Nobody is in Pennsylvania. So our folks are meeting those challenges right now to the best of their abilities. So as Dr. Lay said, the support we can provide them as a community to basically say the work that you're doing is important, the work that you're doing every day in the classroom, nothing's more important than that and more central to our mission, and that we certainly appreciate that work that's happening. Everything else that we do is to remove hurdles for them and to put them in the best situation to succeed with their students. So that was longer than I wanted it to be.
I was getting ready to cut you off, actually.
Thanks.
All right. I had to do it to everyone. Treat you the same. So the calendar of events, and I'm going to give you a disclaimer. October 4th is our next board meeting. Location is to be determined. So if we have a crisis between now and October 4th, and you hear that we are at the administration building back to our home, it's not me avoiding the number of people that want to come speak. I'm letting everybody know in advance. Our goal is to get back to the administration building, but we are going to play it by the opportunity for people to attend here in these board meetings. And as back here, we get our state-of-the-art system that we're able to live stream and have better visuals. If you don't like coming in with a crowd, you can certainly watch real life instead of seeing dots sit here. Having said that, any board, Sylvan, I put something on the agenda for you. I would hope you'd have a comment.
Thank you, Mr. President. Actually, I have 4. The first one, though, is easy, and that's to thank you for including number 11. But I would make a suggestion, because my mother used to call me a PETA, for those of you who know what PETA stands for. But I think we should put the word member between board and comments, because the board is collectively 9 of us, but this is our opportunity as individual members to make comments. Although I have already been told to realize that if each person talks a lot, it's going to take a lot longer for this meeting to get over. So I'm going to get to my 3rd point. And that is to thank the citizens out there who were brave enough to go before the microphone tonight and to share your thoughts and concerns and feelings with us. I think I speak for myself on this one, and some people were confused at the last meeting why I said one thing in one part of the discussion and then voted to have our school solicitor look into the possibility of joining that lawsuit against the governor. But the mandate by our governor and the Department of Health and the Education Secretary is what the board must adhere to at this point in time. And the reason I say that is that until we have a judicial review, democracy isn't working. And the best way now is to find out what type of judicial review we'll have and what that may say, and then this board will have to determine whether that causes us to look at our health and safety plan and take additional action or a different course. But I believe until then, we need to leave democracy work. Thank you.
Al.
Thank you, Mr. President. Just real quickly, welcome, Rebecca. Thank you to the public and for your engagement. I've been around long enough to know that sometimes there are communities that are pretty apathetic with being engaged with their public schools, and even though we may not all agree all the time, the fact that you're here and willing to speak up, I think is a real positive, and that's you are to be commended for that. Also want to thank Harry and Alex and the Gettysburg Times for giving us a fair shake most of the time, and appreciate your efforts and your attendance as well. Thank you.
Hearing nothing further, for the board members, and as transparent as I like, we were going to hold executive session this evening. I am pushing executive session until the next board meeting. The matter at hand is a personnel matter that I believe Mr. McQuaid and the administration need a little additional time before they update us. Any board member individually wants to know, can't do it collectively, I'll fill you in where we're at. Having said that, may I have a motion to adjourn, please?
So moved.
Hodges, second.
Stand adjourned.